There we go. Kia ora koutou, morena everyone. Thank you very much for joining us here this morning at Wellington Hospital. Beside me I have Jamie Duncan, the GDO for Cape Coast and Hutt Valley, and Sue Ramsey, the GM for Protective Services. We're here at Wellington Hospital this morning to, one, acknowledge our hard-working health staff, particularly in emergency departments, but also to talk to our 100-day commitment to increasing ED security. Budget 2024 announced $132 million over 4 years for a sequence of initiatives in ED security, 44 full-time equivalents across the sector, 35 for surge and 12 for training positions. Of them, the 44, 90% are fully deployed, fully established, and the remainder of that resource is taken up by temporary positions. The 35 is spread across, that's the surge capacity. This summer will be spread across 20 hospitals. Very excited about that, and fundamentally every hospital that wasn't one of the 8 hotspot hospitals that asked for resource got their resource and got almost exactly what they were asking for. So that's a good result. I understand the trainers and the escalation specialists have also been very well received. There was financing for 12 of them, and 9 have been deployed, and the remainder will be deployed shortly. So this is several things. First of all, it's supporting our frontline staff. It's supporting them with the security that they need so that they are safe when they come to work. It's also a message to New Zealanders that particularly over this Christmas period, but at any time, if you come into emergency departments, my expectation are that you will respect staff who are trying to help you get better. It's a very simple message. What is also true is that over this past year there has been an increase in violent incidences in emergency departments. Now, we're uncertain whether it's a true increase in violence or just that we're now much better at reporting it. Certainly since the ED initiative has kicked off, and now that we have the trainers out there, the level of awareness and visibility has increased, and therefore we have increased reporting, which is a good thing. But I would just reflect that there has been an increase in violent incidents in emergency departments, which is generally unacceptable across New Zealand, and certainly speaking to our staff here beside me today, here at Wellington as well. And of course this is what the Emergency Department Initiative was all about, to protect staff, to protect patients, and I'm very pleased with how that's rolling out. So some opening remarks, and then I'll turn it over to you.
Why are things so bad in hospitals? Why do we need this?
We need this because you come to hospital in a moment of stress in your life. It's the only reason you would come to hospital. And so in those moments of tension, sometimes decisions are made that are not the best decisions. And so in that stressed environment, we need to be able to protect our clinical frontline and protect other patients as well. That's why we need ED security. It's always been here. We've formalised it and stepped it up through B24.
Minister, nurses have previously linked the increased violence to longer wait times in ED. Is that an understanding you share as well?
Yeah, look, I do think there is a connection there, yeah, and it's not unreasonable to understand that people who are already stressed, they only come to ED because they're not well, and they have a long wait time in ED, that stress level goes up and not down. So yes, I think that is a reasonable connection to make. We'd address that in 2 ways, but the key way would be our target to reduce ED waiting times. That 6-hour target is really where we need to turn our attention. But while that's coming down to an acceptable level, we still need to provide protection for staff and for patients.
So therefore, do you foresee a time in the future in which security to this extent will no longer be needed, or do you think it is a permanent feature in our hospitals now?
Look, I think that would be desirable, but I have a sense that probably we're going to need this increased security, just as the nature of where the world is at the moment, is my sense.
How many vacancies are there? Where's the temporary cover?
I'll pass to Sue here in a moment, but of the 44 full-time equivalents, a substantial number have been fully deployed, and where that resource isn't a full-time equivalent, it'll be a temporary equivalent, so that resource is all taken up. Of the 35 surge, they're all fully deployed, and 9 of the 12 trainers are in place as well. But Sue, do you want to comment further to that question? Level of deployment across those 3 buckets?
Yeah, I think you've captured it, Minister. That's an accurate assessment. Our first surge guards go into place later this week and will remain in place, some of them right through till March, and there's further funding available if there is any other requirement for surge capacity in this financial year.
What's a major event or incident? What could that be?
A major security event at an emergency department could be a shooting victim comes in and there is uncertainty around the situation that caused that, and so you will stand up security at that point, just to be sure that if anything else arrived at the door, that we're well prepared for that.
How frequently are incidents like that occurring?
Incidents such as shooting victims,
Like
or
those really serious
those major
ones
ones?
where you have to surge up.
Not frequently. I couldn't tell you off the top of my head, but I would think at most a major incident once every 2-3 months across the Motu.
Is it quite a noticeable increase over the last, 5 or 10 years or so?
Look, I think if you look at the police data in New Zealand and other sets of data around the world, we are in a more increasingly violent stage of development, if you like. There's uncertainty across the world, and that reflects in the stresses in individuals' lives. So when they present to the hospital, as the Minister said, they come already anxious and, with stress in their daily lives anyway.
Do you have a sense of why summer is the scale of that security comparative to the rest of the year?
Yes, it's really around primarily the concentration of visitors in certain parts of the country. Our holiday destinations tend to attract really significant numbers of people to them, and the local hospitals aren't necessarily resourced to cope with that summer peak. So that's the primary driver for it. And I guess perhaps people on holiday and perhaps might enjoy festive occasions and perhaps become intoxicated on occasions as well.
How is staff feeling? Does staff feel safe at the moment?
I think that's a difficult one to answer. I think the surveys we've done over the last year indicate that some staff still feel unsafe, but where we've put more measures in place around them, then they do feel safer.
In terms of the guards themselves, have there been any incidents of them being injured or hurt?
There are occasional injuries in amongst our security workforce. That tends to come. The biggest group of those injuries is actually slips and falls while they are supporting patients with restraint. That's where we get most security injuries from. There's an occasional assault, but that's not the main cause of injuries. Certainly lost time injuries.
Is there evidence that the presence of security prevents violence from occurring, or is it more there to respond to it when it happens?
If you have a well-trained and well-resourced healthcare security service, because security in a hospital is very different from security outside a hospital, we have to be clinically aligned. We need people who are empathetic as well as being able to have a visible presence. I'm sorry, I forgot the question. My apologies.
Does the visible presence of security prevent violence?
For example, when a new team, a really well-trained team, went into the Auckland Emergency Department a few years back, instantly, from the time they went on the floor, staff reports of violence and abuse dropped by 55% and stayed at that level. So it can have a very powerful impact.
Police are facing back from responding to mental health call-outs and for it.
Keep going, Brady.
Yeah, police are phasing out of unless there's like an immediate threat or risk to life. There is concern that that will create more vulnerable people in EDs being dropped off there, or and safety levels might be compromised. How does this announcement interact with that, with police pulling out?
Sure, so I'll take first pass of that. So they're well prepared, and there are policies in place as police withdraw, particularly from the mental health interface, if you like, in emergency departments. So a lot of planning with emergency departments and a lot of planning with police as to what that transition will look like. At what point then do police become involved as compared to what they've previously been doing. So I'm comfortable that a lot of work in that transition, a lot of policies have been put in place, but it is an area that we've had concern around.
I think that we've already had phase 1 introduced. That didn't produce all of the issues that we were concerned about, or some of us were concerned about. So it's been smoother and less of an issue than we thought. And I think also we need to remember that the police will still triage events as they always do, and if they have the resource to attend, they will attend. So I don't think the change is going to be quite as big across the general hospital as it may appear at first. Certainly there will be some changes to practice around, for example, transportation, those sorts of things, but it's a smaller impact than it might at first have been apparent.
Very good. Thank you very much.